Medicare may not have the fear factor of traditional Halloween ghosts and goblins, but if you don't pay attention to these 5 things, it could haunt you forever. Number 1 is lifetime late enrollment penalties. If you miss your enrollment window and you don't have other qualified coverage that allows you a special enrollment later to delay Medicare, you could be stuck paying penalties every month for the rest of your life. Number 2 is the out-of-pocket trap. That $0 premium may seem sweet until those bills start rising from the dead. On those $0 Medicare Advantage plans, your health care is not free. You just may not pay a premium to the insurance company, but you absolutely have out-of-pocket expenses, which in 2026 could rise to $9,250. And that's for in-network care specifically. And this does not even mention the fact that there are non-Medicare approved expenses that are possible on both Medicare Advantage and traditional Medicare. Number 3 is the annual plan change trick. So every year, Medicare Part C and D plans change, and you can have options that are available this year that are working for you that could haunt you next year when it comes to medications no longer being covered, doctors no longer taking your plan, benefits stripped away, or worse yet, like we're seeing this year, Medicare Advantage and drug plans completely up and leaving the market. Number 4, prior authorization and surprise claim denials. You thought it was covered until you found out that it wasn't. Look, some things are going to require prior authorization, which can delay care or even potentially turn you down for the care you need. And of course, those claims denials are a huge surprise, not only from the standpoint of you maybe needing that for your own health, but then also the fact that you may have to come out of pocket to get it if you are denied. Number 5, the maze of networks and referrals. Now, on original Medicare, you don't need a referral. There is no network. Just need the doctor to take Medicare, you're good to go. In a Medicare Advantage plan, though, much like any other commercial health insurance, ACA, employer group coverage, you are going to be in a managed care plan with a network, and this is where it gets confusing. Does your Medicare Advantage plan require a referral? I don't know. It depends what plan you're in and where you live. Does your policy allow you to go out of network? So is it a PPO or is it an HMO where you can only go in network? Here's some bonus scares for you. Number 1 is the IRMAA monster. So this is the income related monthly adjustment amount for those of you who are higher income earners continuing to work perhaps on Medicare, where your Part B and D premiums are now going to be higher than the average because of your income. Then we have the missing coverage trio, which is dental, vision, and hearing. Medicare, for an aging population, you'd think would cover these things, but dental, basic vision for eye exams and glasses, and hearing aids are not covered by Medicare. You may have that covered by your Medicare Advantage plan. Otherwise, you need to go out and buy a different policy to help cover those things. Last bonus item here for you today in terms of spooky Medicare traps is the underwriting trap for Medigap plans. Yes, just because you think you have access to a Medigap policy does not necessarily mean that you do. Typically, you need to get that at age 65 or when Part B begins. Otherwise, if you think you're going to do Medicare Advantage until you get sick and then switch to a Medigap plan, in most states, you're out of luck. So happy Halloween to you all. It's been my treat to help you learn these Medicare tricks.